So, so if we have a look at this lady, we can see that first of all, we look for danger for the patient, and essentially, and I'm going to take a bit of time to go through this, but if I'm coming in to get a handover from you, I will be able to go whoosh with my surveillance and pick up on all of this all in sort of one go. If I look at danger for the patient does look as if they're safe. You can see the white of the propofol going there, the ventilator's going. Everything seems to be in order in terms of patient safety. As far as my safety goes, it's not an infection control room. It's not any equipment that's in the wrong place. And for the treating team, everything seems to be in order. With response, we can see the propofol's on, that she's sedated. I'm not going to go up and wake her up at this point, but we can assume that under that we can have a look in a little while and see what her response is. Hand ventilating set and oxygen back here behind the ventilator. Okay, and we will check the oxygen under the bed and all that sort of thing as we do our complete assessment. All right, now airway, she is intubated, and you can see that she has an ET tube there that appears to be intact, and we can see the rise and fall of the chest with the breathing and the tidal volume in and out on the ventilator, which seems good. And her oxygen saturations we may have picked up on the monitor as we go around. Her colour certainly looks okay. Circulation, again, we've got the balloon pump there, but we've got the monitor, her colour. You can see maybe inotropes going there. So it's just a quick check that they're all in order, and they are. Disability, she is sedated. We will check that when we do some actual interventions in a minute. The environment is clear. Her body temperature is recorded. We can see that's okay. Her urinary output, she has some in the bag for the hour, that's fine. And the outside environment is ordered and uncluttered. Her full set of vital signs, and you would record them as you would, or take note of them, that they're within normal limits. Okay, so any questions there at all? Okay, so we'll go on to the next gentleman and we'll go through that again for you. All right, so danger. We look at the patient in danger. We can see that he is also sedated. The ventilator seems to be in order. The danger to the patient, he seems safe. Danger to yourself as part of the treating team seems minimal. The patient isn't aggressive or anything like that. Response, we can also see he's sedated and that the equipment for rapid response is there, and we'll check that in a while. His airway, he's intubated, and it's attached to all the tubing to the ventilator. That seems intact. Breathing, and of course airway and breathing really go together. Rise and fall of the chest, you can see the input on the ventilator in and out with the tidal volume. Circulation, his colour is good. We can eyeball up to the monitor, which is up on the left there, and we can see that his blood pressure is okay, but he's on inotropes perhaps on one of the pumps. So we just have a look quickly what that might be at. Disability, we can see that he is sedated, and we will do some neurological assessment in a while, and that he is hard to really establish a baseline there. environment. Body temperature is recorded. That seems he may or may not have a fever. The urine output, there is some in the bag there for that hour, and the environment around is uncluttered and secure. And then we go on to the full set of vital signs. Okay, so that is the process that we will use for you to do your primary survey. It's a little bit different from a trauma primary survey because we tend to wake the patient up when we're doing that type of primary survey. If you do this on a trauma patient and the patient isn't sedated, then you may wish to do that. When we do trauma in second semester, I'll go through the primary survey that we do for trauma patients, which is a little bit more in depth. This is more of a surveillance of your patients. It's when you go from handover to perhaps relieving a patient to when you come back to your patient, or continuously. It's a really good structure to just do a surveillance of the patient and just to maintain their stability and to keep things from deteriorating. All right, any questions about that at all? Okay.